just in their books. But in their books, it is, line diagram. Many of the teachers are not comfortable talking very detail about this. So they just complete the topic in a very open, just upar bolte hain. Let us show them in picture how it actually three-dimensionally also, how the reproductive system, the male and the female is. So what is they see the externally, what are the internal organs they have. So that is basic anatomy, we can show them. Where the uterus is, that is the one which carries the baby, not the stomach. And where is the vagina? The vagina. So where the penis also enters or the baby comes out. So let us talk about it. And what is intersex? No, we can just show them about the different types of sexual. Some of them may not fall into strictly into male or a female. Atypical combinations are there, and hormones and body structures, organs can be a little different. Now, what is healthy and unhealthy? What we want to tell them, and we just have to tell them about what Dr. Preeti rightly said. Sex is not bad after all. Sex is a very nice feeling, or having bit sex is not just biological. There are feelings attached to it. There are hormones and attractions can happen, but we need to observe healthy sexuality. So when they both partners, male or female or whatever, even homosexuality is accepted now. So whenever they are physically and emotionally comfortable, this is healthy sexuality. Once the mind and the body are ready, that's what we want to tell our young people. After 18, they should know the law. After 18, even if before 18, they may have feelings, because physical maturity comes, when the body, hormones, everything kicks by 12, 13, 14, and their attractions start. But we are not allowing them to have sex up to 18. So even with consent, they are not allowed to have. So this they need to know. And so whenever their healthy body is there, when they physically and emotionally they are ready, when the mind and body both are ready, and after 18, that is healthy sexual, maybe intimacy can happen. And the dangerous aspects to this, in the relation between whenever they want to have sex, is without consent is always dangerous. So without consent should not happen, and we should teach our both young boys and girls that please do not accept any force, or without consent. This is totally not acceptable in today's time. Zero tolerance to any force. Then without knowing that it is sex, sometimes the girls and the boys do not know that is what is happening, is that is actually the sex. So one girl who was pregnant at 13 years, when she came to my center, Yuva, we just, we feel that, oh, these girls are too smart. They sometimes, our office people also look at, they become judgmental. They judge their character and say that, see how she became pregnant. But this girl said, I didn't know that physical intimacy of intercourse leads to pregnancy. They didn't know what is sex, actually. So this could be sometimes dangerous. That's why better to make them aware and empower them. What is physical intimacy? What is intercourse? What is sex? How babies are being formed? And I think it's right, and we should tell them. The scientific body like us, very comfortably we can talk about it. Whereas otherwise they will definitely go through all the media, social media, as a lot of information is there. So it may be not be a right information. They may hype it and make it more rosy. Let us tell them the facts. If the mind and body is not mature enough, that could also be dangerous. And if you don't protect yourself, that is also could be a dangerous act. Now coming to the gender, the boy and the girl, this after the XY and XX, what we are seeing, that is the genetic, the chromosomes which tell you are boy and girl. But gender is what you assign after birth. The society assigns them, the parents assign, and they bring them up in a certain way. You're raised as a boy and a girl because of genitalia. The gender identity is the boy and the girl, once they become little big, 10, 11, 12 years, sometimes they don't fit into the gender identity which was given by the society. So they want to be raised differently. They want to be, the genetic expression can be different. The boy who was earlier raised would want to be like a girl, who would like to be identified as a girl. And therefore, we can see this various transgender and other things. So we have to be very important, we have to respect that. So every person has a right for their sexual orientation and presentation. We have to respect that. Our society is not yet open to it, but we are now getting ready. Every aspect, every gender expression should be respected. So we have to just don't take by their clothing, behavior, hairstyle. We can actually, some of them, they are very bold, they can express, but sometimes they do not express because of the societal things. So we have to be a little open about it. Then society expects very differently from the boys and girls. This is also very, very, we have to keep in mind. The boys they expected it's okay if they're mischievous, they're aggressive, they need not be clean, and they need not do homework. But the girls, they have to be very delicate, obedient, submissive. They have to be clean, neat, tidy. They should keep the house clean. They should help the mother. These are the various traditional gender roles. But nowadays we have to raise our children differently. The gender roles are not very different. I mean, very clear now. It could be a change is happening. The females who were culturally defined earlier with their responsibilities are now not doing that because of their education. They're coming out. They're entering into all aspects of the careers, and they are having a lot of They also want to become career is a very priority for them. They want to become independent. So they are having no more the priority for marriage or having a family. Even for a girl, we all feel girls should be doing this first. The education is next. You have to take care, you have to get married, you have to have a family, you have to have children. That is your primary goal. The other things are all secondary. Then still balance. Even if you have children, you have to balance your domestic work and then come into the professional thing. Then you are good. You are supposed to be a good, sort of, we are still judgmental. But for the male, we do not have that sort of pressure. For the male, is still the head of the family, and that typical aggressive attitude, all risk-taking behavior, all is normalized for them, and they are supposed to be earning. But that is also a little, nowadays you can see the male now they have to cope up. That's why this year in the HA also we thought of getting a module for the adolescent boy. The boys are seeing this change. Their fathers were raised differently. Now this present generation have to cope up with the changing times. The women are coming out. They have become career oriented. The marriage and family is also not a priority sometimes for them. So the male cannot expect the female to come and cook or take the domestic aspects and all that. So they have to now cope up with the changing scenario. So they require nurturing, maybe they require counseling. They also have to understand the gender respect. Why there's a gender violence? Because the males have been brought up in a different way, maybe, and maybe they were not exposed to the they were brought up differently, and they're not exposed to the women coming out, and the women who are now working in all areas, who are doing in the even difficult times. They are supposed to be safe. They have to take care of their own safety, and the society is not. I mean, we are seeing this still happening. There's a lot of time to we have to really change and hope that things will change. Slowly we can see that this will happen. Now, coming to the gender diversity, the temporarily we also feel in the when 10, 11, 12 years, they could be a temporary phenomena. The teen may not want to be the way they are raised. So it can be a transient phenomena. They could be shifting thoughts between feeling like a male, female, or a gender. They may not have any gender. They don't want to be called as a male, female, nothing. They don't want any gender to be attached. Sometimes we get this situation also. So, but finally, some of them will settle. And after when they become adult, they finally settle with some identity, but they can still remain without any identity. So this gender diversity has to be accommodated. We should not humiliate or outcast them. So this is we need to keep in mind. Now, sexual orientation, feeling attracted to the same sex or opposite sex, this happens very common and should be normal. It is normal or not? If you do not get attracted to some person and maybe at particular age, I would say the parents and all of us should get a little worried. What is happening? The hormones are there, and then what is happening? Why they are not still getting? This is a normal thing. So we should not make it in the schools and colleges. Most of the administrators, the principals, and the teachers get very disturbed when they see a child about 14, 15, 16 years around that time, when they see this attractions happening, when love letters are seen, or even in the cupboards, that the parents also get very curious to know what this child is doing, his or his child. They get very disturbed, and especially with more about homosexual orientation, they get even more disturbed. So we have to really actually adapt to the situation. It is very normal. Homosexual orientation is also a one expression and of their identity. So we have to respect that. It is the wish of the adolescent. He will define how he wants to be raised, with whom he wants to have any sexual relation with, whether it is heterosexual, homosexual. It is he who will decide. So this is what we need to respect. Now, coming to the act of sex, I think we can just there. Actually, most of the adolescents, or even all of us, we have go in India when we are. It is a very funny situation because we have a lot of sexuality around. We have a lot of songs which celebrate the romance and many things, Dil Mastani and all that, and even about the body and our thing. We talk about so many songs are there, and we have our Khajurahos, our Konaks who talk about the expression, the way, even age old. All this is there on the walls, and but still we don't talk about sex and sexuality. So this is actually the nature's greatest gift. It is not only for reproduction, it is also an act of intimacy to express love, to derive and give pleasure. M.K.C. Nair sir says always give. The giving is the most important aspect than deriving pleasure if it is a healthy sexuality or healthy sexual intimacy. That was he always says. It is important for survival of the species. We are all mammalians. We have to procreate to, if you have to continue with our species. So it is important for that also. So it is remember, it is the nature's greatest gift. It is such a lovely thing, but we should not take it as a dirty thing. So but important thing is there's a lot of turbulence in adolescence. So we don't want them to get into this up to 18. But we also understand the prefrontal cortex is not made mature, whereas that is a part which helps us with the decision making and the time management, etc. So we want them to wait till maybe 23, 24, 25. Therefore, the legal age of marriage is also being raised now. So, but how to keep them safe between that 10, 11 years to 24, 25. So there is a rapid growth of their physical body, psychological, intellectual, sexual domains during this time. There's a lot of turbulence during this age of adolescence. There's a surge of both not only the growth hormone, the sex hormones, external appearance is also changing. They become more attractive. The reproductive organs are also growing by now. The uterus becomes big. The penis enlarges. Then there's a lot of that readiness for procreation is there. Secondary sexual characters also develop. The breast develop and the hair develops. So they make them more attractive. And reproductive functionality is also attained by now, and the erections start happening. There is the feelings start, the sexual feelings start. Their thoughts and emotions are also there by this time. So there always a likelihood at this time that they may enter into romantic relationships or sexual attractions because of sexual attractions. So appreciating, one thing we have to remember. Can we mute them, please? Appreciating someone as being desirable or feeling, what is romantic relationship actually? So when we say when we call this a romantic relationship, appreciating someone as being desirable. You are looking nice, or sometimes I love you, or I want to, maybe desirable. That feeling, if you have, that is a romantic relationship. Feeling of belongingness, because they have to understand. We have to make our young people understand, because they feel they're in friendly relationship. He's only my friend. But if they have to identify when it is romantic relationship. Feeling they need to know that. So feeling of belongingness with that individual on a sexual note. Even sexting, it can happen online, even with your phones. So it need not be just physical. So desire of getting close. They want to be emotionally and physically close with that individual, and experiencing emotional and bodily surges while thinking about the person. Even the thought of the person, you get excited. So when you are in when you get all these feelings, it is a romantic relationship, or you're having the sexual attraction. You also have to make them understand this other words like infatuation, crush, and love. We all laugh. We all must have had this some interaction during our teenage, right? We should be open, I think, Yes, so we must have had on a crush on a teacher, crush on somebody who's very junior, very senior, but it was like, maybe we have overcome that and now we laugh it off, So what is actually this? What is the difference between infatuation and love? So infatuation is the looks matter. The external appearance really, that is the most important thing. And we get crushed when we see a person, and we love certain, even small things like that particular nose, the part of the one particular body, that also actually attracts them. But actually in the love, it is the qualities of the person that matter. It is short lasting versus long lasting. More important self, your equal respect for partners, values, and thoughts. There is a domination, demandedness is there. There encroachment on personal space. Where there is a care, there in the love, it is caring and sharing. There's secrecy in infatuation. There it is liberty and freedom. There's a insistence and hurry for physical intimacy, and it is like plucking the flower. But there it is openness. There is patience. Actually they wait till they actually get consent and then enter. And it is akin to nurturing the plant. It is no more of nurturing. There is slowness there, and you wait till it matures. Then there's also this phenomenon called breakup in adolescents. Breakup ho gaya, very nice famous songs. And there you can all we deal with such situations when we deal with young people. The adolescents or youth who are affected by breakups can be depressed. Can have this aggression behavior also. So I love her, so she has to love me. Sometimes it is so aggressive. So when there's such a situation, we also have to know we have to empower the adolescent how to handle a breakup also. And there can be acid attacks, there could be gender violence, they can when a failed relationship is there. So we have to teach or maybe empower our adolescents about this gender equity and equality. Gender equality. So what is this? So they should not be, because of we are seeing violence so much against women nowadays. Why it is all happening? Crime against women. Men, they are traditionally physically stronger. Now we had a patriarchal society. Even now, model of men being power at home and in society was there. There was a favoritism. Even now, I think it's slowly fading. We are in a changing scenario. For boys, media also plays an important role. The way they project the woman as sex objects, and we can see, in movies and all that. When the woman, they are shown very differently as a products. Pornography also plays a big role in gender violence. They picturize the sex as very, the way they picturize the sex, which is actually very unnatural and impossible. They portray the woman as sexual object. Sex is viewed as a purely physical act. There's no emotion attached. It actually perverts the concept of woman, and it could be addictive. Most of the boys may get addicted, even sometimes accidentally, and even women are also maybe getting into this, the media. So we have to also be talk about all this, that this is not safe for them, and let us address the myths and what are the facts. So in the myths, we can see this eve teasing and all that. They feel, the boys feel it is macho. It is okay to throw a stone at the woman or talk something passing by. It is like a male phenomenon, macho, and they feel the girls love it. And girls are weak. They feel the girls are weak and tolerant. None would know what they're doing. None would question me. My parents do not bother. My favorite hero gets the girl after chasing her. But the facts is actually it causes low self-esteem, and there is a poor values. They feel insulted. The girls feel insulted and unsafe. So they have to, when we have to talk to the boys, that by just doing this eve teasing, they are not becoming a hero in front of the girls' eyes. The girls are actually very confident and maybe equipped with self-defense. We have to teach them. Many places have the CCTV, so they can be punished, and that can ruin their career. And this real life is not real life. So we have to talk to the young adolescents about all this. Now, this also has a very famous movie. What is this movie name? Pink.
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 So we have to teach the young adolescents what no means no. When she says no, it means no. So this thing is a very nicely told in this movie. So no force at all. We have to orient our young adolescents and youth about this. Of course, Dr. Sukanta sir will take about this. We also tell about the POXO Act, so that they know about the legal aspects. If at all they're being abused, how to report and when to report. Now a little bit on STIC. After the good thing, let us also talk about the young people if they are not taking any safety precautions when they're having a sexual act, because they could be ending with some infection, and it could be vaginal through any type of sex, and it could be harmful for the sexual organs. It may result in disease, infertility, or cancer. It may also have long-term consequences. So please do not neglect. Even in the early stages, they have to get them treated. So this could be some dangerous, and we have to just tell them at least about some symptoms. They could be burning in the urine, itching in the vaginal area. There could be regular period, severe pain, even in the pain, or scrotal pain or testis pain. So the different types of infections are there, like your the other tract infections. Like you always get treated if you have other infections. Why don't you get treated for this? Please do not hide. If you're having any of the symptom, go approach your doctor. We have also Suraksha clinics in the government sector. Now, regarding little bit of the boys, these are, let us talk a little bit about them. They have a lot of problems related to their body parts, and they have a lot of doubts. They don't have any area, neither the parents talk to them, no counselor, no counseling. I mean, no particular person is there where they can open up and talk. So I think the adolescent boy module should really reach out to the adolescents through through AHA. So they have this about the apprehensions about the penis size and about their ejaculations, masturbating. Can they should feel they are confident, they go into sex workers just to prove themselves. So let us talk a little bit about their other as STIs also a little bit, and about Dr. Kalpana was mentioning about HIV also. So because this is among the young people, one third, the one third in India are from 15 to this age. Just imagine. So let us tell our youth, to be protective at least. If they cannot stop having sexual activity, first of all, of course, we are saying them at least before 18, no sexual activity. And in case they are becoming sexual active, let us teach them about protective behaviors, and what is the harm in getting go to the sexual partners or other things, and how can it pass the infection to others. So you be safe and let others be safe. And what is HIV, what is AIDS, let us tell them at least the basics. Right. So condoms prevent it, and the serious infection can decrease your immunity. So let us at least prevent and protect. Now about the boys, girls also, there are a lot of problems. Their doubts about their, even they masturbate. It is not just the boys. So about their periods, they have a lot of doubts about the breast size, and about the private parts also. So let us talk about hygiene of the private parts, how to what is normal, what is abnormal discharge, and what is menses, and when they have to come to the doctor, and even that premenstrual syndrome, and trimming of hair is advised, not the removal, razor hair removing creams to be avoided, and they can have some infections there. So please take care of some hygiene. Start with hygiene and go to the parts of the. You can enter into sexuality talk through various means. Talk about growth development, come to the pubertal changes, or you can go by talking to by about hygiene and then enter into this parts of the body, and then go into the sexual intimacy and all that things. So gentle hygiene is extremely important. How to wash, and avoiding soap to clean the vagina is important. Let us tell them. And the private parts from front to back, how to all these things. Yeah, about their periods, and what is now the menstrual cycle. This we are telling them, but we please tell them that they're ovulating too, not just how the to use a sanitary pad, and what are the myths, and of course what is normal period, what is abnormal, when to come to the doctor, when it's too early or too late, and too frequent, too infrequent, too much bleeding, too much pain, vaginal discharge, yeah, and about PCODs, about painful menstruation, and poor menstrual hygiene. Please, we have to tell them about the daily bath and changing pads at least 8 hours. And when there's a poor menstrual hygiene, what happens? It can lead to even UTI and other things. And sanitary pads, how to dispose. ये तो बोल रहे हैं, but tell them about ovulation. That's what I was stressing. So that they're ovulating and they can become pregnant. For the boys also, you have to tell them the ejaculation, the sperm fluid has sperms. And this sperms and this ovum, when they come together through the physical act of intimacy, when they have erections or the erected penis that enters the vagina of the female, there is ejaculation, and this fluid enters. The sperms can meet the ovum, and then that's how the embryo is formed and the baby is formed. And the baby is in the uterus till 9 months, and the baby comes out through the vagina. So this simple, you can finish in 1 minute talking about intercourse and how the babies are born. So these are all things we can talk to them. So I think this is a holistic, I've covered about, I hope within the time frame of just a few, it's a very huge, we can do a workshop on this whole day, but I end saying that this is comprehensive sexuality education, talking about their body parts and their behavior, gender equality, and how to talk about safety and reporting, legal points. All this have to be told, extremely essential for the adolescents and youth. Please empower them. And this will prevent them from unwanted pregnancy and sexually transmitted infections. It also promotes gender respect and prevent gender violence. And we have to promote their life skills, how to say no. And it's important for them to decide when they want to have sexual intimacy, with whom they want, and it is their right to have healthy reproductive tract, and also to with whom they want to have sexual relation. It is their right, how they want to be oriented, and with how they want to be brought and addressed by the society. So we have to promote this awareness about the rights and the life skills. We pediatricians have a very significant role to play in imparting comprehensive sexuality education. Healthy sexuality is very important. It is a need. It is actually we have to procreate, and the families have to be there. Babies have to come into this world. We are seeing an extreme situation where we scare them. They're really not getting into committed relationship. They don't want to have families and children. So we need not push them to that extent. Let us promote healthy sexuality. And at the end, I would like to appeal to all of you, please join this youth wellness program, which was started by the Aich in 2025. And let us celebrate Youth Wellness Day on 18th of every month. And let us bring in these topics wherever possible so that we empower our youth. Thank you so much. Thank you.
Thank you, ma'am, for wonderfully explaining, and it's so simply explaining such a difficult topic. And there are some questions we will take at the end of this of the session. So now we would move to our next talk by Dr. Sukanta Chatterjee, sir. Sir, over to you for talking to us on POXO and the relevant facts about it.
Is my screen visible?
Yes, sir.
Yes, sir. Yes, sir. It's visible.
Yes, sir. Make it full screen, sir.
Full screen. Full screen.
Okay.
Slides shows. Yeah.
Is it okay?
Absolutely. You can go on, sir.
Okay. Now I'll take up the POXO Act. One of my colleague in AHA asked me how to introduce POXO Act to adolescents. Well, the way we can apply the basic principles of medicine that we do. First of all, we assess the knowledge, what they know about it, and then how much they know, and from there we start and proceed. So that's how we go when we go to school for different programs and meet adolescents. I present to them 5 questions. The first interaction is, have you heard of POXO Act? And obviously, most of them might say no, and it depends. Some of them might say yes. Well, the next question will be, could you make statements? What do you understand by it? And then we sum it up. The exact meaning of it, what they tell, and then we sum it up. So that could be the next interaction. Third could be, could it affect you? For those who said yes, we'll ask them, tell me how. And those who said no, then we'll also say that, well, if you know what is POXO Act, then why you say it is no? We can discuss it further, how it can affect them. Now, could POXO affect you when you are in mutual consent relationship? That is also another very important issue that adolescents are now putting to us. Do we have the right to have faithful mutual consent relationship or not? So this is another issue that we have to discuss and address with them. And those who said no, we ask them, mention why. Those who said yes, then we ask them how you could be affected, and we discuss it. Then we put the last question. What do you think is the appropriate age of introducing the knowledge of POXO Act to empower a child or adolescent? And tell us your logic. So then we open the discussion. So this is how we enter into it. Now, the window of opportunity, when and how we introduce it, is through sexuality education. And we all know that sexual education is a continuous process. It might even start as early as 5 years by saying good touch and bad touch and all that. Now, scope of most effective reiteration and sensitization in adolescent, the time of onset of secondary sexual changes, that's Talukdar,
বারবার প্রশ্ন
menarche,
করতে পারি না, আমি দুবার জিজ্ঞেস করেছিলাম,
or nocturnal emission.
তুই বললো যে বাবলি বলেছিল মা আসতে চাইছে না, মা আসবে না বলেছে।
Well, I'll request.
Please mute all.
Yes.
Shilpi, please mute.
Sukanta, please unmute yourself.
Shilpi, please unmute Sukanta.
Yes, sir, I'm fine. Sir, Sukanta sir, please unmute yourself. I've unmuted,
Yes.
sir. Yes.
Okay. Am I audible now?
Yes, sir.
Yes.
Okay. So, explaining reproductive and sexual changes during puberty to teens along with insights on the impact of POXO Act can be a thoughtful approach. Now, this is a flowchart by which we can also go take the POXO Act in appropriate place. So when there is menarche or spermarchy or say nocturnal emission, we'll tell them that this is a sign of maturity and you are now able to become father or mother. And so you should behave responsibly in your romantic relations. My previous speaker, Dr. Himabindu, has nicely described what does romantic relation means. So everyone has the desire to develop romantic relation. So they should start becoming responsible in developing and behaving in romantic relation. Sexual urge and feelings develop due to the instinct. So if there is yet to develop romantic relation, then they might adapt self-stimulation or masturbation. Well, there are a lot of myths and others, and I'm not going to elaborate on that. So that is a different session. So, but masturbation is not abnormal so long it is not affecting your health, not only uh, physical health, mental health, social health, and all other aspects of health. Now, if you are developing romantic partners or romantic relations, then the POXO Act becomes relevant to you. The two important things in POXO Act, the consent and privacy. Any sexual act or intimacy in public is punishable. That is important that we need to tell them. And the consent. Some adolescents have got this wrong idea that when they are faithful to one partner, the mutual relationship is not a crime. So this is written in literature, this is shown in movies and all that, but by law it is not. And if they consent, then even whether the consent is valid, before 18 years of age, the consent is not valid and therefore the act may be criminalized and the state administration might punish them as per POXO Act. That is important to understand them, that even police and administration might harass them that you are in, say, romantic relationship or rather in some sort of unseen or nude position, so you are subject to POXO Act. So this sort of harassments also they might have to face. So these things they must know and they should protect themselves. And when the consent is valid, they are above 18, then also in without marriage the pregnancy may be unwanted and that might lead to, and without marriage then it is lead to psychological and social or medical issues. So this is in short the flow chart that we can show. Now coming to the clinic, how you start and how you tell a girl. Now initiate the discussion on puberty when thelarchy is noted. Before that, at 6 years, there is no point talking about the POXO Act and the menstruations and all that. So when the thelarchy has come, then you start about the menstruation, anticipatory guidance, and the POXO Act and its implications. Have you noticed growing up how to start discussion? Have you noticed growing up breastbuds of girls of your class or amongst your friends? So this is how we start from the third person, the general principle of medicine. How many of your classmates or friends are having this change? What do you feel about it? Do you know why it happens? So gradually you're entering into the level of knowledge. How much they know and then how much we have to give. Have you heard of periods? Does any of your friends get periods? Do you get periods yourself? Since when? What is your thought on periods? Do you know why it happens? And then gradually, the possibility of becoming pregnant and all those things we can discuss depending on their thoughts and their interactions. Similarly, for the boys, testicular enlargement is the most obvious sign, but that's embarrassing. What you go for boys is by the height spots, or androgenic hairs on the face, then we should start anticipatory guidance. Like, say, how many of your friends are taller or shorter than you in your class? So, how many of your friends have started growing mustache or beard? Do you know why these changes happen? Have you heard of wet dreams? Have any of your friends had it? And whether you had it or not? And what is your concept regarding this change? And here we bring in what we have shown in the flowchart, that you are now mature enough to become a father, so behave responsibly. This is important, and here we can enter into the POXO Act. So POXO Act sensitization in adolescents in anticipatory guidance is very important, and we have to create opportunity or look for the opportunities if they are not asking for it. And we must have clear understanding on the adolescents how they will protect themselves legally and ethically and protect their rights against abuse and exploitation that I have already mentioned. Now, child sexual abuse is increasing in India, and you are aware of it through newspaper and also in literatures also. So, why it is increasing and what to do? You can see the how many POXO cases are pending in different states. It's 2023 statistics from the law ministry, and the different judgments of, say, high courts and local courts, that the POXO Act is being implemented, teachers being sentenced, and 10 years rigorous imprisonment on the accused of POXO case, and Supreme Court viewing child porno is offense under POXO Act. So 25% of POXO cases are romantic relations. So this is again another very important aspect where we, the adolescent healthcare specialists, must work on. The, the society will not thrive unless the mutual relationship and love and affection develops, and the adolescents are getting opportunity to explore their developmental needs. So again, another very important point that we should remember, that boys are unnecessarily victimized due to the POXO Act because they are considered the perpetrator. So these are again different examples of this teen dating and all that. And POXO Act enacted to protect children from sexual assault, not to punish minors in romantic or consensual relationship and brand them as criminals. This is Bombay High Court's observation, but this is not law. Observation is not law. So we must think of that the consensual sex as a matter of tug of war between developmental need of adolescents and the legal obligation for adolescents. That's why we must be very proactive in creating opportunities or looking for opportunities to introduce POXO Act so that the adolescents get the POXO adequate knowledge to have informed knowledge and act or behave accordingly. The AHA, working on the IAP, FOXY, and IPHA and IPSM, these 5 organizations having more than 1 lakh professionals in India, has developed a statement that we should work for the welfare of the adolescents' health in the line of government of India, and that you can see here all the presidents, FOXY president, IP president, Dr. Basavaraja, and Sanghamitra Ghosh and others. Geeta Patil was the chairperson at that time, and myself is there. Dr. Atanu Bhadra is also there. It's signed in the Bombay office. This is the agreement. So we are working on it, and we have also published joint statement on this sexuality education to make people aware that this is a developmental need and they should not be criminalized. The Joint Professional Forum of these 5 organizations also developed comprehensive adolescent health education module, which we have developed after 6 months of rigorous work of multiple expert groups taking from all these 5 organizations, and we have released it in the last Predicon. We are looking for its roll out in the schools and different IP programs. This is another very important thing that is developed by AHA again under the leadership of Dr. Geeta Patil to teach each program, that is how teachers will tell the students about the sexuality education. And this is also a work towards the, I should say, clearing doubt of the adolescents, and also making the teachers easy how to speak to the students whom they always consider not friends but as the words or the students. This is another landmark that this year Dr. Himabindu has started the youth wellness program that recently this banner is released, flyer. So we are all aware it and proud of it that this will continue. So this is how AHA is trying to project the most sensitive part of the adolescent health, the comprehensive sexuality education. But the most important issue is what we call in Bengali, Kamone Bolibo Shama Bhabitai Dinarajini. How to tell it to the adolescents, how to empower them to be conversant about that and to take an informed decision. That is most important. Well, thereafter, this is a few case examples. I could stop here if the time doesn't permit, because this is absolutely technical and this is for our own professional members. But before that, what I have talked, it is for the adolescents to whom we should work and how we could work and what we are doing through AHA and other organizations. I think
Sir.
I'll thank you here before I take one or two cases.
Yes,
Say,
sir,
for
please.
example, doctor refused to examine a victim of sexual assault who was brought to the hospital directly for treatment, citing that this is a medical legal case and required a police requisition or magistrate order to examine. Is the doctor correct? Well, obviously, the answer is no, because getting treatment is the right of the sexual victim, and um, there is no need of any police report or police information. Treat first and then inform police. So, a 13-year-old girl, victim of sexual assault, was brought to the hospital for treatment. Mother insists on you to conduct the medical examination. Girl doesn't consent for examination. Now, what the doctor will do? Is this consent valid? The girl is not giving consent, mother is giving consent. Whose consent to take? Well, after 12 years, a girl can give consent for non-invasive medical examination. Therefore, the girl's consent is valid here, and we should respect the girl's refusal, and we should explain the refusal and write a note about the informed consent refusal, explaining pros and cons of such medical examination. This is how the POXO Act we have to take up. And to all of my colleagues, I must say that the POXO Act and the reporting of the sexual assault and injuries are all available in the website in the Ministry of Health and Family Welfare, where the guidelines for the care of the victim of the sexual assault survivors. This is a document all of us should read who are doing adolescent health care. I am not going further. There are many other examples because it's already 10:15. We have started as 1.5 hours back. So I'll stop here and thank you and give back to Shilpi and the organizers.
Thank you, sir, for a wonderful talk. And definitely, sir, the consent, the mutual relation with consent, that's a very doubtful situation. We are all having questions regarding that. So, and there are questions in the chat box. One question was to Dr. Himabindu ma'am that how to tell a 13-year-old boy regarding how he was born.
Yeah, for 12 and 13-year-old boy.
1 minute, I'm just checking.
Actually, it depends on, from his understanding level. Like from 8, 9 years, we can start talking about it. Like rightly said by Dr. Sukanta sir also, we can start with his body parts and how he was born. We can, depending on it, some children are quite advanced in understanding because of the exposure, maybe the family exposure or the media exposure. So they will able to take it. But some of them who have not been exposed at all, so we can just try to understand the level of understanding first and maturity. So we, because depending on that, this we can slowly talk about the sexual act, how it that leads to actually the babies being formed. So that sexual act, it depends on the way, without getting intimidated or feeling shy or uncomfortable. You should be able to tell. Maybe for that age we can just say that in the beginning we can say in a phased manner. So depending on his understanding, we can just say that, see, I will tell you later. You can say that in the beginning, that yes, it is between when there's a physical intimacy between a boy and a girl, or the mother and father. You're born in a family. After all, we used to say family life education to all these things earlier. We used to hesitate to call it sexual education. So we introduced like family like education, because family can the sab kuch hai. What all you can see is there in the family, the parts of the body, the male, boy, girl, chote. We all see our brothers and sisters, no, when they take bath and all. So you can, it's not so hidden or secret in the family. You can see the body parts and how girls and boys are different, and father, mother, how they are. They can also see sense of romance between both of them when they become a little older, which adolescent boys and girls can start. So we can have friendly discussions with them about how a romantic relationship starts, and how they when the age comes in, the hormones come in, there can be erections. So erection, regarding that also, it happens when their hormones are there. So when they physically they start getting mature, so we can talk about these words called physical maturity, their erections. Then sexual intimacy, if they cannot, you're not able to tell at 12, 13, you can say, I will explain to you when you are a little older. So better is to tell that than saying that shoo 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 shoo, don't talk about all these things, all dirty things, ये कुछ नहीं बात करना है, ये ऐसे नहीं बोलना है. Don't shut the thing and saying it's dirty or bad. The curiosity will increase and they'll go to other places. So you say, I will, yes, definitely I will address this. You come back to me, or maybe I will tell you later.
So
So
may I interact here?
yes, sir.
Yes, sir.
Sukanta, sir.
So, well, it all depends about what you said is the understanding of the boy.
That's what I said.
Now, it may be that the boy knows it, but he is asking you to listen from your mouth, how you present it.
Yes.
So, the way I ask them that, what is your understanding? How a boy is born or a son is born? What is your understanding? And then he may hide it. Then I might say, well, in romantic relations, a boy and a girl ultimately meets, and then you must have read from the knowledge of biology that the ovum comes from the girl in the birth passage, and the sperm goes from the penis, delivered in the birth passage by erected penis, and then ultimately a baby is born. So this much we can say, that is fine, that is science, but we take the way that you have mentioned, that give them the science, and then
Yes. Give
also
them
the,
science.
yes, maybe I have this I have faced in one of the school in IIT Kharagpur campus. I still remember the boys are so advanced that they were asking what are the types of condoms, what is vibrating condoms, and all those. Many years back, I'm
Yes,
telling you.
yes.
So
Yes.
the knowledge, we should never underestimate them. They
Underestimate.
might also tease us, or
Yes.
might also
Yeah, yeah.
try to know that how we express it, how we
Yes.
express it.
So they may check your, whether you're updated or not
Yes,
also.
yes, yes,
So different types of experiences, I should say there's no standard way. Each one of us can build up our own way of dealing with the situation.
yes.
But we have to talk. We have to comfortably talk about it. We should not be uncomfortable, and scientific and comfortable.
Uh,
Anything?
Madam Himabindu, just a question.
Yes,
Uh,
Ashim.
how do we go about telling this comprehensive sexuality education on a mass scale?
Mass scale.
Because
Yes.
we will be facing difficulty when we try to enter into schools. Most of the
Yeah.
schools would be against this. So, can you give us a way out? How can we overcome this?
Yeah, we are all doing this, Ashimji, through our organizations. And when an organization of a high caliber, a technical organization like doctors, so we can, it is easy for us. Individually, maybe we may have some resistance. But if we go through organizations like AHA or IAP, who's working with young people, in fact, some of the schools, though they were resistant, now they are quite, actually, they want somebody to come and tell them. Because most of the teachers are distressed also. They are seeing a lot of, because they spend long hours in school. So they are, more than the parents, the teachers are observing who's into romantic relationship. They suspect कि ये इसके साथ girlfriend, boyfriend, ये सब वो सब in thing है. So the teachers also want to get empowered, and this, even the institutions are actually inviting people who can talk about it. Many are not available for them who can talk comfortably on sexuality. So as an organization, it is a better way where it will be better received. So better to use the platform of our organizations to approach, and collaboration with Foxy, IMA, other organizations also we can do who are working, non-governmental NGOs who are good authenticated NGOs who are working with. That's why UNICEF is also we are taking on board. So UNICEF is technically partnering with us in this year, and throughout this country we want to do this sexual awareness program through AHA along with UNICEF. So this will be a better received, I think so. So let us try this year.
Yes, yes, madam. I'll share my experience here also, that in schools when we go, the teachers, we tell them that we are doing adolescent health awareness program, and we request one of the teacher to be there, and we again apply the same principle, what they need to know or what they want to know. So we give them a slip, and then tell them,
Yeah.
don't write your name, what you want to know from us as a doctor today, which you cannot ask to your teacher or parents. So they write these things, and we start with non-sensitive issues like nutrition, and then say sleep issues, education issues, and then we also said that, see, some of them has also written this. So in that we gradually enter into the topic, and the teachers also know that they have discussed everything, but this is response to their questions. They may not ask these questions. I'm sure some of them will ask it. I have never seen that a class has never asked any of such questions. Even if they do not ask, we might utilize that. Well, some of you have asked these questions. That also could be a technique to introduce this.
Just want to again come back. Yes, Sukanta sir and all of us, we did this way. We entered all these years, we did the same way. Entered with growth development, hygiene, nutrition, and we did this question box sessions, and we addressed all that. But this year we are little getting bolder. We're 25 years old and beyond, so we are growing up, and then we are little getting bolder. We put the sexual wellness as part of our youth wellness program. In our program itself, we are telling, and we'll give the takers, we'll tell the schools who want this. We have 6 sessions, and we made sexual awareness program as a mandatory along with mental health and vaccination. So we are getting a little bolder. So let us see
Yes.
how it works out. And now we have this joint professional forum also. We are all going through a little boldly this year. And this organization, better to go with organizations than individually. I think let us join this movement and join the wave of empowerment.
Madam, just a thought. Can we sensitize the Ministry of Education from the central AHA
Why
to the
not? Yes,
central
yes.
government, and
Every
they,
state,
yeah,
yes,
and then they
yes,
send directives to the respective
yes,
state
yes,
government's education department that CAHA is ready with this
yes.
program, and you take help of CAHA for promoting
Yes,
these
Ashim
modules.
bhai, we are getting ready for that. We started first, instead of going from above below, we are going from below up. We have started doing work, and many of our young pediatric ambassadors are already joining with, and now we are involving the youth. See, basically, if we are doing standalone, now when we involve the youth and they start demanding, then automatically all the departments will start responding. कि भाई youth पूछ रहा है. They are now we are involving them in our every aspect. So we have changed a little bit change the gears. Involving the youth makes a lot of, I think it adds that thing, that need-based approach. And then when we involve them and they are asking for it, it's easy for the departments, government bodies to get convinced. UNICEF is coming with us. So slowly we're going to now approach the ministry. So we already have started talking, inquiring whether they are ready. And I think if things go fine, we'll be also involving the Ministry of Government Ministry of Health and Women Development Child Welfare. Maybe it will take few months, but definitely we are trying to do that. And even now,
Thank you.
every state AHA can, if you have good ties with personally with somebody, like I did in my state, Telangana, a few years back. I was the IAP president of the state. So I worked with the principal secretary of Women Development Child Welfare. He was so convinced and happy that he released funds And our IAP pediatricians used to go and conduct classes. He was giving honorarium to them. He gave instruction to the district administration. In every district, the collector used to call the pediatrician, give him a vehicle, and identify the school, mapping the schools, colleges. They used to be so royal. They used to go and give this conduct sessions on media coverage with media coverage. So it depends. You can still try at your own level, at the state level, but as a central aid body, we are going along with the UNICEF, and we'll be approaching the ministry soon.
Thank you, ma'am. Thank you.
Thank you, ma'am, for the wonderful efforts that Chairperson is putting. And I would like to acknowledge presence of Dr. Sudhir Mishra, sir, who has also written in the chat box that regarding the sexual assault. Sir, are you there at this? Sir has written that
Good
in case of
evening.
sexual.
Good evening,
sir.
everybody.
Good evening, Sudhirji. Good evening. Good evening.
Acknowledging.
Yes, sir. We welcome you to say a few words before we end. Okay, sir is muted now. So I would now like to welcome Dr. Santa Chattopadhyay, who is our Joint Secretary, to give a vote of thanks.
Thank you, Dr. Shilpi, for the opportunity. So it is my immense pleasure to extend a heartfelt vote of thanks to everyone who has contributed to making this webinar a great success. And I think both our distinguished speakers, they have done absolute justice to today's theme, navigating us from curiosity to clarity of information on adolescent sexuality, which is so important for us to understand. So first and foremost, my deepest gratitude to our distinguished speakers of today's, Dr. Himabindu Singh Madam and Dr. Sukanta Chatterjee Sir, for their invaluable insights on such crucial topics like comprehensive sexuality education and POXO Act, how to introduce it in adolescents. And I think both of their expertise and knowledge have truly enlightened us on these topics. A special thanks to all our esteemed guests whose presence and words of blessings have enriched this session, and your commitment to adolescent health upliftment is truly commendable. I would also like to express my sincere appreciation to all the office bearers of Central IAP, Central AHA, WBAP, WBAHA for their leadership and dedication in making this event possible. A big thanks to our technical team, WBAP office, for ensuring the smooth execution of this event. And finally, to the wonderful audience, there were maximum 70. I noticed 70 participants at one point of time had attended this webinar. So thank you for your active participation and engagement, and your enthusiasm and curiosity would make these discussions meaningful and impactful. So as we conclude, let us carry forward the knowledge that we have gained today and
sorry to interrupt. There are some questions also. How shall we answer it? Can we answer it in
quickly? We'll answer that. Yeah, please. I think
okay, so
Nagamani's lot of comments like yeah, can you one by one, can you quickly...
One question is that in one of the sessions with gynecologist, a question was raised whether we should talk about sex toys. Girls wanted to know what is AHA stand on it.
Can I respond?
Yes, please.
So I think AHA to respond on this, I need the the consensus from my executive board. We need to really discuss about this. But then as an individual, I would say that see, it is like masturbation. When we we say when you have an itch, you eat yourself. It is applies for both boys and girls. So we think masturbation is only for men, but even for the women, if they have any sexual desire and they want to still be safe and not get into intimate sexual relation with others, and they may experiment with those sexual sex toys, etc. So we would just talk about saying that it is safer than having a sexual intercourse if you want to explore the sexual the desires. But then the stand of AHA, we have not still discussed this thing. Definitely, I will put this into our discussion with our committee, and we'll definitely come with some consensus and stand on this. Thank you.
Thank you, ma'am. And others are the last one. Should there be sex education chapter in school?
Definitely, it is already
Yes.
there. It is already
To
there, but
discuss.
we
Yes.
need more discussion on that. They usually do it like, typical parts of the body and all. Little emotional aspects and the other relationship aspects should also be dealt.
That is coming, but not getting say accepted. The main issue is that the government is scared of the political and social backlash. The sexuality education, central government has given clearance to start it in the school, but again it has been withdrawn and it has been sent to the parliamentary committee, and they said that right now it's not right time to do. And again they have started saying yes, you go ahead. So
Now
this
it is
is
yes.
hiccup that is going on is only because of backlash, because our society is not yet so progressive. We are not saying say everyone is so free and open to discuss about sex, and even the father and mother is free to talk about sex with the daughter and the son, and neither the teacher. So this is a situation that will gradually change, and till then the government will do this hiccup up and down, and we have to customize as and when necessary the situation we have to utilize. But as rightly Himabindu said, that the AHA policy is an official thing. If you ask, then she has to take the executive board decision and all that. Sexual toys is fine, but that is like masturbation, but hygiene must be maintained. Otherwise, you might acquire many infections and other things, and you might also get addicted to it. Also, that's also important. These things are also known.
One more question is that if there is consensual sex between two minors, POCSO Act is applicable. Can
Yes.
police or someone
Yes,
else
yes,
harass?
Yes, it is. It
Are they
is. It
always
is
a
liable to
applicable.
punish?
likelihood. There's always a likelihood. Yes.
Yes, it is applicable. It is applicable, and the doctor's duty, if they come to know that I have one case, I have not told that due to shortage of time, that two minors have done this, and the boy's mother has came to the doctor with the boy, and then the doctor reported it to the police, and necessary counseling done. What is the good or bad of it, and what should be done in future, and all that. But these are punishable offense, and doctors is bound to report to the police and also give medical, I should say, care as an necessary. Not only counseling, if there is any physical injuries and others, that should be also taken care of.
And one more question by Latika Bala ma'am, that when can we attend TOT on CSE?
Yeah, that's a very soon. Myself, Sukanta sir, all of us are planning. All the four presidents are planning. And once our PPTs are ready, we'll immediately start in all the CT levels.
Yes.
And
Yes,
we're
yes.
planning to do that very soon, Latika.
Yes. I have already talked with Rajesh Mehta, who might talk to you, Dr. Himabindu, tomorrow.
Yes, yes, sir. Yes, sir. We are as curious and as enthusiastic to start this as early as possible.
Yes. The funds are ready in your hand.
Thank you. Thank you.
Thank you so much,
madam.
and over
Thank
to
you,
Shankar.
Sukanta sir.
So, with the permission of Dr. Ashim sir, may we conclude
Yeah,
this session?
Absolutely.
So, let's
Absolutely,
carry
Shanta.
forward the knowledge gained today and hope we'll meet soon again. So, thank you again.
Thank
Thank
you
you
so
all.
much.
Thank you, and good night.
Thank you. Good night,
Good night.
Thank you
everyone.
so
Thank
much.
you. Bye-bye.
Good
Stay
night,
safe.
everybody.
Bye,
Good
bye,
night.
bye.
Thank you, ma'am.
Thank
Thank
Bye,
you,
bye.
ma'am.
Good night.
Thank you so
Bye.
much.
Thank you, Shukanta.
Good night.
Thank you, Shilpi
Good night.
Shankar. Dr.
Thank you.
Himabindu.
Thank you, ma'am.
Bye.
Thank you.